Wrist pain got you down, we've got your back, and wrist. Let's start by understanding the different types of wrist pain and what might be causing that nagging discomfort. One of the most common culprits is tendinopathies, like de Quervain's tenosynovitis. This condition affects the tendons on the thumb side of your wrist, often caused by repetitive movements, and can make simple tasks like gripping or turning your wrist pretty painful. Then we have Carpal Tunnel Syndrome, a condition that develops when the median nerve, which runs through a narrow passageway in your wrist called the carpal tunnel, gets compressed. You might experience tingling, numbness, or pain in your hand, especially at night. Wrist sprains are another common issue, often resulting from a sudden impact or fall. You'll likely experience pain, swelling, and bruising, making it difficult to move your wrist normally. Ganglion cysts are non-cancerous, fluid-filled lumps that can develop near tendons or joints in your wrist. They can be painless or cause aching, stiffness, and weakness. Of course, we can't forget about fractures. A broken bone in your wrist is hard to miss, causing intense pain, swelling, and difficulty moving your hand. For my older viewers, osteoarthritis, a degenerative joint disease, can also affect the wrist, leading to pain, stiffness, and reduced range of motion. And finally, we have Kienböck's disease, a rare condition that affects the blood supply to one of the small bones in your wrist, leading to pain, stiffness, and eventually, even arthritis. Remember guys, this isn't an exhaustive list, but it covers some of the most frequent troublemakers behind wrist pain. Now that we've covered some common types of wrist pain, let's talk about how doctors figure out what's going on. It all starts with you telling your doctor about your symptoms, when the pain started, and any activities that make it better or worse. Next comes the physical exam. Your doctor will examine your wrist, checking for tenderness, swelling, range of motion, and any signs of nerve compression. Depending on what your doctor suspects, they might order some imaging tests. X-rays are great for visualizing bones and can help diagnose fractures or arthritis. Ultrasounds use sound waves to create images of your tendons, ligaments, and muscles, helping to identify issues like tendinitis or ganglion cysts. MRIs provide highly detailed images of your wrist's bones and soft tissues, making them useful for diagnosing more complex conditions like ligament tears or cartilage damage. Finally, if your doctor suspects nerve involvement, like carpal tunnel syndrome, they might recommend a nerve conduction study or electromyography, often referred to as EMG. These tests measure how well your nerves are conducting electrical signals, helping to pinpoint any areas of compression or damage. Getting the right diagnosis is crucial for determining the most effective treatment plan for your specific type of wrist pain. Okay, so you've been diagnosed, now what? The good news is there are plenty of treatment options for wrist pain, and many cases can be managed without surgery. Conservative therapies are often the first line of defense. Rest is essential for allowing your wrist to heal, and ice packs can help reduce inflammation and numb the pain. Ice for no more than 20 minutes, and be careful not to get a freezer burn. Not all ice packs are made to go directly on the skin. Splinting or bracing your wrist can provide support, limit movement, and give those overworked tendons and muscles a chance to rest and recover. Over-the-counter pain relievers like ibuprofen or naproxen can help manage pain and inflammation. But it's always a good idea to check with your doctor before taking any medication. Topical creams or gels containing pain-relieving ingredients like capsaicin or menthol can also provide temporary relief. Physical therapy plays a crucial role in wrist pain recovery. A therapist can teach you exercises to improve strength, flexibility, and range of motion in your wrist and hand. Chiropractic adjustments can also be helpful for some people, especially if wrist pain is related to joint restrictions in the wrist, elbow, or shoulder. Now, in some cases, conservative treatments might not be enough. If your pain is severe, persistent, or caused by a more complex issue like a fracture or severe nerve compression, surgery might be necessary. In addition to traditional treatments, there are some advanced options that can provide significant relief for wrist pain. Corticosteroid injections deliver powerful anti-inflammatory medication directly into the affected area, quickly reducing pain and swelling. Platelet-rich plasma, PRP therapy, involves injecting a concentrated solution of your own platelets into the injured area. Platelets contain growth factors that promote healing and tissue regeneration. Another innovative treatment option is shockwave therapy. This non-invasive procedure uses high-energy sound waves to stimulate healing and reduce pain in tendons and other soft tissues. Deep tissue laser can use light energy to facilitate healing and decrease inflammation as well. These interventional therapies can be particularly effective for conditions like tendinopathies, ligament injuries, and certain types of arthritis. It's important to discuss these options with your doctor to determine if they're right for your specific condition. Prevention is always better than cure, right? So let's talk about some practical tips to keep your wrists healthy and pain-free. Ergonomics, people. Make sure your workspace is set up to minimize strain on your wrists. Use ergonomic keyboards, mouse pads, and wrist rests to maintain a neutral wrist position while you work. Warm up those wrists before any activity that involves repetitive hand movements. Simple stretches can make a world of difference. Strong forearms equal happy wrists. Incorporate exercises that strengthen your forearm muscles into your routine to improve wrist stability and prevent injuries. Avoid putting prolonged pressure on your wrists. If you use tools for work or hobbies, make sure they have cushioned grips and take frequent breaks to give your wrists a rest. Wrist guards are your best friend if you play sports or engage in activities that put your wrists at risk. They provide support and protection, reducing the risk of sprains and fractures. And finally, listen to your body. Don't ignore persistent pain or swelling in your wrist. Early diagnosis and treatment are key to preventing long-term problems. That's a wrap on wrist pain, everyone. We've covered a lot of ground today, from understanding the different types of wrist pain and how it's diagnosed to exploring various treatment options and prevention strategies. Remember, if you're experiencing persistent wrist pain, don't hesitate to seek professional help. Early diagnosis and treatment are crucial for preventing long-term complications and getting you back to doing the things you love. If you found this video helpful, give it a thumbs up, share it with your friends and family, and don't forget to subscribe for more informative health content. Until next time, stay healthy and pain-free.